ما لها يومئذ تحدث أخبارها بأن ربك أوحى لها يومئذ يصدر الناس أشتاتا ليروا أعمالهم فمن يعمل مثقال ذرة خيرا يره ومن يعمل مثقال ذرة شرا يره صدق الله العلي العظيم. In the name of Allah, the Beneficent, the Merciful, when the earth shall quake with her terrible quaking, and the earth bringeth forth her burdens, and man shall say, what has happened to her? On that day she shall relate her news about all that happened on her. The Lord has revealed whatever the Lord has revealed unto her. On that day shall come out people from their graves in scattered groups to be shown their own deeds. Then he who has done an atom weight of good shall see it, and he who has done an atom weight of evil shall see it. Sadaqallahul Azim. In the name of Allah, the Beneficent, the Merciful. The surah that I have recited today is known as Surah Al-Zilzal, the quaking, and this surah was revealed at Makkah. The first two verses refer to the violent effects of destruction and disaster the earth will suffer on the day of judgment. The entire earth will be quacked and get reduced to nothing, bursting and throwing out all its contents. The sudden upheaval and the uprooting of the mountains and the strongest structures on earth and the conversion of the earth as a whole will only confound man. The earth will declare aloud what all had happened on it. Bibi Fatima alayhi salam reports that once in Medina an earthquake was felt and the people got panicky and rushed to Abu Bakr and Omar, who took the whole multitude to the door of Ali alayhi salam. Hazrat Ali came out with perfect peace of mind, took the people outside Medina, and sitting on a mount, addressed the huge crowd, asking them, you are panicky at the quaking of the earth. What will you do when it will quake before the day of judgment? Ali alayhi salam then placed his hand on the ground and addressing the earth said, what has happened to you? The quaking stopped and the shaking of the houses of Medina suddenly ceased. Hazrat Ali then turned to the multitude and asked, do you wonder at this? I am the one to whom the earth will speak on the day of judgment, and he recited this surah. The Holy Prophet is reported to have said, save yourselves from calamities by always being clean with ablution. Save yourselves by always being regular in your prayers. Beware of your good and evil deeds on earth, for it will disclose everything on the day of judgment. Since the day of final judgment will be the day of sorting out the good and the evil stuff in humanity, the dead will be divided into groups of good and bad according to various levels of their merit and demerit, and rising from their graves rush to know what is there for them by way of their own earning in this world in the record of their own deeds. This is the first stage of total resurrection. Note how man is warned of the strictness with which he will be dealt with in the accounting for his deeds. Even the smallest deeds, good or evil, will not escape the accounting and will be duly recompensed, and no one will be able to bear the burden of the other. These verses in this surah have been taken as to signify that our actions here assume concrete forms on the resurrection day, causing pleasure or pain. وآخر دعوانا أن الحمد لله رب العالمين.
Please say Fatiha for all the Marhumin. Fatiha. Bismillah ar-Rahman ar-Rahim. This is for your information. The Jamaat is holding an election for the president. So those people who haven't paid their subscription yet, the seniors pay £10 for family. For you to be able to vote, please pay your subscription by Friday. That is the deadline the Jamaat have set for you to be able to vote. Also, please register your spouses for them to vote as well. I will ask Hamid Bhai. And there is an interface tonight. Interfaith 7:30, yeah? At 7:30. I'll ask Hamid Bhai to give us the background about this election for the president.
محمد وآل محمد صلوات. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. والصلاة والسلام على محمد وآل بيته الطيبين الطاهرين. صلوات. ભાઈઓ તમે યાદી નહીં કરતા, હું કેમ્પેઇન કરવા નથી આવ્યો અહીંયા. મને છે ને ખાલી થોડુંક બેકગ્રાઉન્ડ ઇન્ફોર્મેશન દેવું તો આ ઇલેક્શનના બારામાં, કારણ કે આઈ થિંક થોડાક ક્વેશ્ચન્સ છે, કાં ક્વેરીઝ છે માણસોને કે અબાઉટ ધ પ્રોસેસ, કે આ કેવી રીતના ઇલેક્શન થયું છે. તો ખાલી 2-3 મિનિટ વાસ્તે થોડુંક બેકગ્રાઉન્ડ દઈ દઉં તો કે આ રેઝિગ્નેશન્સ જે થયા છે ઈસીમાં ને એ બધું. તો જે લાસ્ટ ઇલેક્શન્સ જે થયા હતા મેમાં, તો એમાં જ્યારે ઇલેક્ટોરલ કમિશનર્સે જે ડિસિશન લીધું હતું કે ધ ઇલેક્શન્સ આર નલ એન્ડ વોઇડ, એના પછી એ લોકોએ જે કરંટ ઈસી છે આપણી જમાતની, તો એ લોકોને ટાઈમ આપવામાં આવ્યો હતો કે બિકોઝ ધ લાસ્ટ ઇલેક્શન વોઝ નલ એન્ડ વોઇડ, તો એ લોકો ઓફિસમાં રહી શકે છે અન્ટિલ મે ઓફ નેક્સ્ટ યર. પણ ધ કમિટી હેડ ઓબ્વિયસલી ડિસાઇડેડ કે એ લોકો કોન્સ્ટિટ્યુશનમાં જે ચેન્જીસની ને જરૂર છે એ લોકો લઈ આવશે, એના પછી ડિસેમ્બરમાં એ લોકો ઇલેક્શન્સ કોલ કરી શકે. હવે આ જે આપણા ઇલેક્શન્સ છે જે 17 ડિસેમ્બરના છે, તો એના લીધે ઇલેક્શન્સ ટ્રિગર થયા છે કે હવે ઓરિજિનલી એ લોકોનો ટાઈમ હતો અન્ટિલ મે ઓફ નેક્સ્ટ યર, તો એ લોકોને જો ઓફિસમાં રહેવું હોત તો એ લોકો મે સુધી રહી શક્યા હોત નેક્સ્ટ યર. પણ બિકોઝ એ લોકોએ પ્રોમિસ કર્યું હતું કે ડિસેમ્બરમાં ઇલેક્શન્સ લઈ આવશે, હવે ઇલેક્શન્સ લઈ આવવા વાસ્તે એ લોકોને 4 રેઝિગ્નેશન્સની જરૂર હતી, જેમાં પ્રેસિડન્ટ ને પછી 3 ઈસીનું રેઝિગ્નેશન જો થઈ જાય તો પછી એ લોકો પ્રોસેસ છે એઝ પાર્ટ ઓફ ધ કોન્સ્ટિટ્યુશન, કે જો એવી રીતના થાય તો પછી નવા ઇલેક્શન્સ ઓટોમેટિકલી ટ્રિગર થઈ જાય. તો આ જે રેઝિગ્નેશન્સ થયા છે, સો દેટ માણસોના મગજમાં કોઈ જાતનું ડાઉટ ના હોય કે આ કેમ થયું છે કે શું થયું છે, ઇટ ઇઝ ઓનલી because of the constitution process to bring the elections, the new elections in. તો મેં કીધું જરાક એ ક્લેરિફાય કરી લે, કોઈને બીજું કંઈ ડાઉટ હોય મગજમાં કે આ રેઝિગ્નેશન શું કામ થયા આટલા બધાને શું થયું, but it is only part of the constitution process to trigger the new elections. Yeah, for Muhammad wa ali Muhammad sallallahu alaihi
I think it was passed in the election here. I mean, there was a meeting, AGM meeting, Jamaat, and they said that all the senior citizens have to pay £5 per person. But if it is a family, husband and wife, then it is £10. No, for the Jamaat.
For the Jamaat.
Senior, we collect. That's in January.
I didn't know about Jamaat.
Oh yes.
This is about Jamaat.
I wanted to ask this question now.
Yeah.
Same, we did not know anything about
Oh,
that.
there was a meeting here?
Huh?
There was a meeting?
Well, that time we were not here, you see, maybe.
So-
Now that time, you see, a year ago maybe.
Mr. Chairman,
Yeah.
if we are not here, it is not a problem of Jamaat.
Yeah.
It is our problem that we
Yeah,
are
yeah,
not
yeah.
here. We cannot now query why we have to pay.
Yeah, yeah.
It has been decided by the general body
Right.
that we have to pay, so we have to pay.
We have
Right.
to pay,
Yeah, if you
no,
are
that
not
is
here,
okay,
then-
we
yeah.
have to pay, all right,
But
Mr.
it's not your problem.
Mukerjee. We are ready to pay, even 100 pounds we are ready to pay. But we must know that.
Yeah, yeah.
You see, we are ready, it is our community.
Yeah, of course, of
It
course.
is our community, our families.
Right.
You see.
So,
It was decided
Master
by the
Sam,
general body that
if
we
you
pay.
want to vote in the election,
Look, just now, yes,
yeah,
yes.
if you want to vote,
No,
we have to
go
pay
or
£5.
no go. You see, that is not the problem.
no, you are right.
Whatever Jamaat is decided, we
Right,
have
yeah,
to
yeah,
agree
yeah.
that one.
I think we,
Pay, go
Yeah.
or no go.
Yeah,
You
okay.
see, that is your personal problem.
yes.
But we must know.
Okay. Can I also suggest to our members here, can you please go to the Jamaat website and the information is there. So
Whatever.
if you could go there,
Aye.
then we will have it. If you go to your
Kareem.
Alaikum Salam. So please, if you want some more information, please go to the Jamaat website. They've given this all information there.
all right, sir, let's continue. Julia.
Can I?
Before we invite nani guest or
No.
nani you Shini Khalfan.
Okay.
Yeah.
We have got a guest today, Brother Shani
Khalfan.
Khalfan from Canada, yeah?
From Toronto.
From Toronto. Please welcome to our gathering.
Hi.
And now, can you please welcome our brother Muntazir Ali here, who's going to give us a talk on oral hygiene.
Well, we'll see.
Whatever.
Yeah?
I'll try. Okay, is this working? Assalamu alaikum. Those who don't know me obviously are not coming to the mosque enough. Otherwise, everybody should know who I am. And assalamu alaikum. The talk is going to be on dentistry because I am a dentist, but it's not going to be anything to do with the teeth. I just want to raise your awareness on what is available, what is the caliber of your dentist should be, what standard of care you should be expecting from your dentist. So it's not going to be much about teeth at all. In this country, we provide care on three bases. It's a mixed care system. It's an NHS system, but it used to be very good, and it used to provide free care for elderly people as well, but it's no longer the case. Those who don't understand the NHS system, I will just give you a brief summary of it so you know where your rights are on what is available to you. It is provided free even today to people who are claiming certain benefits. One of them is pension credit as well, or income support for pregnant ladies, and a year after. Children under 18 is free. The system they have brought in 2006 is broken down into three charges. So you will either pay a sum of about £20, £53 or £244. These are the three charges you'll ever be asked to pay if your dentist is working on the NHS. For the first lot, you are allowed sort of checkups and a simple clean and some x-rays. The £54 you pay whether you need the first lot and you need 1 filling, 20 fillings, 4 root canals, whatever you need that does not involve prosthetic work. And the third item is if you have a denture or a bridge or something like that, you will pay that fee, £244. It's a bit like going to Marks and Spencer and paying £50 for a trouser, but saying I want 4 shirts, 2 ties and a shoes as well, which they're not going to give you. So what happens when you go to your dentist, they don't want to do as much work. And it's very good system if all your patients have good teeth, because they don't need much work. It's a very bad system if you have bad teeth. So the government doesn't look like it's going to change it. They've been trying new pilots and things, but the system's not going to change. Second is insurance scheme, where you will pay a monthly fee, £30 or £20 a month, for which your dentist will provide all the care unless you need laboratory work, and you pay that charge. The danger there is you keep paying monthly and the dentist gets used to that money but doesn't do enough work that needs doing. And when you change the dentist, the new one says, oh, you need so many things done, because the last one got complacent. So every system has got its flaws. The third one being fee per item, where you pay for what you want. And that is probably how majority of the work is being done now, right? Before 2006, my income was 95% NHS. Now it's 99% private. So I gave up working for the NHS in 2006. But let's move away from there, because what I really want to talk about is the medical aspects of dentistry. So how do you know what you're going to see or who you're going to see? How good is she or how good is he? I want you to be able to judge. If I'm pretending to be a patient and you're sitting in the waiting room, and I'll give you one or two examples of patients, one of who is here probably, and he has given me permission to speak about it. When you're you've made an appointment, you sit in the waiting area, and you're welcomed, you're given a form to fill for your medicines, whatever you take, and that's where your experience starts. Next is your time comes. If he's or she is running on time, your nurse will come out and call you, Mr. Kasmali, please, or whatever, and you will go inside the surgery and sit down, and your dentist might be sitting on a stool there, welcomes you, you sit down, and you open your mouth and he examines you. Does this sound very familiar? That is the experience. Now, if you observe this, analyze that walk from the waiting area to the chair, you will know your practitioner, how awake are they. Now you need to know yourself. Now, if the dentist has not moved from his chair or she to come and welcome you, they've sent somebody in, right? There's a lot of psychology involved here. He has missed shaking hands with you, observing your walk for the last 3 seconds to your room. When you come inside the chair, you sit down and you just open your mouth. There's a lot goes on from the start to that he or she has missed. And this is what I'm going to tell you, what he has missed. He comes out or she comes out to call you. I'll say he, but you know what I mean. And you get up and he will say hello, smile. You're walking towards him. He has missed out on observing you. Right? What he can see from your smile is first your front teeth and your gums. He can tell straight away. Number one. Number two, he can see whether your face is symmetrical. Have you got a swelling on one side or you have on another? He will see when you smile whether your lips or one is down or your eyes are drooping. There's a lot of diagnosis happens even from the gait, your style of walking. These are all medical aspects. That's why I said I'm not talking about teeth. You sat on the chair and they say open wide. You don't do that. Your teeth should be closed. And I'll come to that later. You'll see a couple of videos. Well, I'll give you an example. This is 3 things that happened to me in the last 10 years. I'm going to give you 2 examples or 3. And how much good can be done by a dentist. Forget about a doctor. All right? The first example is, this happened last week. A very young South African Zimbabwean girl came to see me, professional lady, very smart. She came an appointment. I went out, called her, shook her hands, and she came and sat down. Now the story was long, and she didn't have a dental problem, but she still made a dentist appointment. So I asked her, what is the problem? She goes, somebody recommended to come and see you. I go, nice, thank you very much. I said, what is your complaint? She goes, I have itching on my chin. Right? Now, she's been to 2 dentists. Normally if somebody says that, there's something wrong with your lower teeth. So I took an x-ray, I said, I can't find anything wrong. She said the other 2 dentists couldn't either. So she went to her GP. The GP told her to put some Bonjela because that will numb up the itching and will stop itching, like babies have toothache and you rub them. Now when she came in, I shook her hand. I said, welcome. Her handshake was not strong for a young woman. And I observed that her right eye had a tear in it, but the left eye did not have a tear in it. This is all about diagnosis. Because the dentists are all trained carpenters. We can do repair work with our eyes closed. Because yes, you've been trained. If you are a road sweeper, you can do it with your eyes closed after 10 years. If you're a heart surgeon, he'll just open your chest, put it. You might be shaking, but for him, it's a game. Because you've been trained to do it. But the diagnosis is the problem. You don't treat the symptom. You must treat the cause. Rubbing Bonjela was just masking the chur. It was not finding out where it was coming from. So I said, okay, have a seat. There was nothing wrong on the x-ray. So I said, smile please. Now 3 things have already happened. Her right eyelid was wet, the left wasn't. Her handshake was not strong. And when I asked her to smile, it was not symmetrical. The right lip was down, a tiny bit. Okay? So I said, let me have a look in the mouth. I took a very sharp pin and I put it on the gums in the middle. She said, I can feel that. I said, okay, second tooth, I can feel it. The third one, she could not feel. I put the whole pin, half an inch into the gum. She could not feel a thing. Went further back, the last 2 teeth, she can't feel anything. The middle 3, she can. The problem here is not teeth. She's seen 2 dentists, she's seen a GP, and nobody's bothered to spend 2 minutes to talk to her. She's either already had a stroke, or she's got a tumor pressing on her nerve. It was an emergency referral to the hospital. Now she's wasted a month, which could have a drastic effect on her life. The diagnosis was not done. It was a quick question, go to the dentist, have an x-ray, I can't find anything wrong, £22.40. Thank you very much, goodbye. There you will judge who is treating you, cares about you as a person, or is just the teeth. Because you know, everybody goes to work. Some people go to work just to earn money. Some people go to work because they love their job. They are totally dedicated to it. You need to find those people. And you will know after today's lecture, I'm not Tokeiro. A dental examination, you will see a proper examination on video. If you're a dentist, even I may do half of what they show you. We are all lazy, we are all complacent, guilty of complacency. But if what they show you, and your dentist does half, you are with a good carer. Okay? That's one example. The second one is a gentleman from here came to see me about 10 years ago in Kenton. And he's told me you can talk about it. So I always shake hands with people. And in his case, because he comes here and all that, I call him Jomba, so I gave him a hug. But I bothered to go out, get him from the waiting area and walk him in. Again I shook hands with him. Not a strong handshake. And he's a very strong man. When I hugged him, you can hear the breathing was not right. He was breathing fast, but he didn't realize that. So as I hold his hand, I also took the pulse. And I told him, I'm not taking your tooth out today. He said, no, I feel fine. I said, you don't look fine, you don't feel fine. I called his daughter, sent him to his GP, and I faxed his GP because I didn't let him drive. He went to his GP, the GP examined him, sent him straight to casualty. They did an exercise test, and they said, go home and sit down. You need an angiogram and angioplasty now. They called him back. His wife phoned me, his daughter phoned me, and he phoned me. They said the GP was very happy that you sent him straight and you didn't take a tooth out. We prevented a big heart attack. And Murtaza Bhai Bandali will confirm that. It was he who was the patient. And he had his angioplasty, which lasted 8 years. He's had a bypass. He's 80 plus now, and he's not had a heart attack. But it was observation. and diagnosis. These are the two things that are important from any carer. The GP who told her to run Bonchella and the dentist who didn't bother to take it further should be shot if this woman dies early. I was that angry, I wanted to phone them because it was just about a quick consultation. Get rid of the patient, get the next one in. And that is not what it should be about. Now, my talk is going to be a little bit biased towards oral cancer because I want you to wake up a little bit. So if we can have the first video, please. I was shocked to find this video because the chap who's talking on it for about 2 minutes turned out to be my lecturer
Top
from
tips for
1983.
detecting mouth cancer, I think, is looking at the soft tissues, and if you're seeing anything that's abnormal, questioning what is that. And mouth cancer, 95% of mouth cancers are squamous cell carcinoma. These are the cells that line the mouth, so it should be able to see. It's something that's on the surface. It's not like some other cancers in the humans, which lurk within the body and then can't be seen. It's using your eyes and making sure you examine the soft tissues thoroughly. Well, examining the soft tissues does take time, but in fact it's not that much time. I think with good lighting and perhaps the use of loupes, and then this can be easily done within a couple of minutes. And it's so important, those couple of minutes could be so important to that patient. Mouth cancer, whilst not being the most common cancers, is important due to the 5-year survival. The 5-year survival is only 50%. That is, 50% of people will die post-diagnosis, regardless of the treatment, and that is a horrible statistic. So it's the sad thing and the worrying and the thing about mouth cancer is the 5-year survival. Diagnostic aids, the best aids you've got are your eyes and your hands, and you will see things, as I say, the lesions, mouth cancer's on the surface, you should be able to see it, but also equally get a pair of gloves on and feel it. Inflammatory lesions tend to feel soft, whereas cancers tend to feel hard. So it's eyes and fingers. There are a number of tests around that could help you diagnose mouth cancer, and that's based on looking at the cells on the surface of the cancer, or perhaps putting a stain on that will stain up abnormal cells. Or there are a number of diagnostic aids that work on the wavelength of light, where the light is either absorbed or reflected by the cancer, and that is in contrast to the surrounding normal tissues. These, unfortunately, are not sensitive and specific enough to be used as a gold standard diagnostic, but it certainly raises awareness, and I think would perhaps give practitioners more confidence that they have examined the soft tissues thoroughly.
Okay. The things that he said important was the only tools you need to find early was, what did he say? Hands and eyes. You don't need any technology. You need to pick it up early. Very early for patients. If you don't pick it up early, what did he say were the statistics? 5 years max. 50% of people die. So if you think about a growth, cancer is a growth. If you have a growth in your tummy, it will grow and your tummy will extend or whatever. If it's in your mouth, you can't swallow. If you can't swallow, the game's over. Now, symptoms, you won't know what are the symptoms. How do you know you have it? But presentation is number one. You can see, like, the numbness this lady complained about. You need to be awake. That, why am I getting numbness? If you have difficulty swallowing, straight away you need to mention it. If you are wearing dentures, if the shape of your jaw is changing, they're not going to fit. You will notice ઢીલા થઈ ગયા છે dentures, કે tight થઈ ગયા છે. Something's not right. The fitting's wrong. You might blame the dentist for not making a good denture, but it's nothing to do with that. Because the shape is changing inside, something's growing. And if you think something's growing in your mouth, what's going to change? The way your teeth meet, they won't meet properly. You will find your bite has changed. You will find, you don't look at your tongue every day. We don't check it. If your dentist is not checking it, is the most important thing the dentist should be doing first, because nobody has died without teeth. It's the first lesson they give you in dental school. You are not important. People who have no teeth, they live very comfortable lives on smoothies. Nobody dies without teeth. But now lifestyle has changed. 30 years ago, at the age of 60, people had no teeth, they had dentures. Now you have 90-year-old people who will not wear dentures. They want to have implants and whatever, because they don't want to wear false teeth. So it's shifted a lot. And as you live longer, those teeth get a lot of wear and tear. But I'm basing this towards the cancer awareness more and more. So these are the symptoms. It's like there is a bone disease called Paget's disease. And how do they actually find out you got Paget's disease? Is if your hat doesn't fit, the shape is changing, and always suddenly people note my hat doesn't fit. It's got Paget's disease. So things you will notice in your mouth. But if you go to your dentist, now this is where I'm coming. You're sitting on the chair now, you can miss all the other observations and diagnoses that your dentist has missed. Sitting on the chair and you open wide, the first thing is you should have your teeth closed. The dentist should actually open your lips so you can see the inside of the lip, the bottom of the inside of the lip, the whole of your cheek, left and right, and feel it. You're looking for hard things, not soft. He calls it soft tissue because this is all soft. The hard is the teeth and the bone. So when your finger rubs into the patient's cheek, you will find any abnormalities. And if it is there, legally, you find any abnormality. Legally, I need to note it. Call you back in 2 weeks. If it's not gone, you must go for a biopsy. There is a legal case going on. A dentist in Scotland noticed a patient with an ulcer. Now, the ulcer should go away in 2 weeks. And you call the patient back. And if the ulcer is still there, you need to refer them to the hospital for biopsy. This patient moved from a village in Scotland to Cambridge. And they didn't go back for that ulcer check. The dentist in Cambridge 6 months later noticed it and sent the patient, and the cancer had spread. That dentist wasn't told the patient has moved. But it was his duty to follow up. He didn't. He should have phoned or booked the appointment in 2 weeks. If the patient didn't turn up or something, that's fine. But he didn't book them. He was struck off. He can't practice anymore because he didn't follow it up. Because you don't know how serious it is. It's his job. So what we do in my practice, for example, we will take a photograph of everything and book you in 2 weeks. If your ulcer is still there, you will be referred. An ulcer is one of the main giveaways. That is, you will see one photograph at the end which will, there's nothing wrong here. You can't tell. The video 2 is a 3-minute long video, but this is a classic examination, extraorally, which is outside. So you're looking at the patient sitting down and how the clinician examines the patient. And then intraorally, how they check for swellings, lumps, ulcers. These are the things you will find under your tongue. If you go home today, pull your tongue out and to the left, you will notice lumps on the right side at the back and on the left side. Don't be alarmed. When people see this for the first time, they are taste buds. We didn't know that until we went to school. The second, third year dentists learn, then they realize these are taste buds. But any other observation, all you need to do is pull your tongue out. The most common site is on the side. You will find a little ulcer. That tells you. And this examination you have to do yourself. If you are not going every 6 months, you can have very good teeth. So why should I go to the dentist? I don't have a problem. But you pay that £40 for this examination. It's very cheap. If he finds anything abnormal, it's actually cheap money to pay. Yeah, so this is a 3-minute video. I think it's made by one of the hospitals. I don't know which country, but it's quite good.
In this
Showing you
instructional
observations.
video, we will demonstrate how to perform the proper technique of the extra intraoral examination. Observe the patient upon reception. The visual examination, you're going to check the extraoral tissues. These include the forehead, the eyes, cheek, nose, lips, and neck. For the palpation examination, the clinician would don examination gloves. Bilateral palpation of the submental area. submandibular area, preauricular nodes, post-auricular nodes, occipital nodes,
Nobody examines this part of your body if you think about it.
the anterior and posterior chain of the cervical lymph nodes along the sternocleidomastoid muscle right side and left side. Lastly, the nodes of the neck, the supraclavicular nodes, the clavicle area to the shoulders.
These areas will show you if there is any spread
You'll
from somewhere
palpate the
else.
thyroid
The
gland.
nodes will be very hard.
Ask the patient to swallow. A bilateral palpation of the TMJ. Ask the patient to open and close. The parotid gland, have the patient clench. Now you will wash or sanitize your hands and apply new gloves.
That was outside the mouth examination. If your dentist does a third of that, you should be happy. All right?
Visual examination, observe the labial mucosa, upper lip and lower lip.
Exactly what I was saying.
The buccal mucosa, right side and left side. The palate, hard and soft. The posterior pharynx, patient says ah. The tongue and floor of the mouth. Palpation examination. The labial tissues, upper and lower lip, retract with your index finger and thumb. The buccal mucosa, bimanually the index finger and the middle finger of the opposite hand, right side and left side. For the palate, use your index finger to palpate the hard and soft palate. A piece of gauze for the tongue. The clinician will
In
use the gauze
practice,
to
it takes
grasp
30
the
seconds
tongue,
to do this, if not less.
checking the lateral borders,
It's not time consuming at
the
all.
dorsum and ventral
Slow
surfaces.
down for this.
Also palpating the posterior and the middle third. The floor of the mouth. Clinician will instruct the patient to raise the tongue as they palpate from posterior to anterior on both sides. This concludes the extraoral and intraoral examination.
Done. Thank you. Can you put the last few slides?
All right. Hi, everyone. I'm just going to give you a
Stop
quick
that.
demonstration on how we do our intraoral exam. Okay? So I have...
Okay. This is a picture of a tongue. I don't know if you can see it, but there's a round circle. Can you see a round circle? White. This woman, it's a man, I think, sorry. He came to see me. He said, I have not been to a dentist for 6 years. Right? I just thought I should go to a dentist. I said, okay. They had bad teeth. But I never look at teeth first, because you can repair teeth. We are all carpenters. So I did this and I found this circle. It was Tuesday morning. I sent her to Clementine Churchill at 2 o'clock. She was operated on Friday. It was the smallest cancer. It was picked up because of that picture. And it's 9 years now, cancer-free. The consultant phoned me and he said, thank you for sending me an easy case. 6 months later, she would have had half a jaw removed. Going to the dentist, just examine your soft tissues. Very good thing to do. going to the hygienist regularly. She will be doing this as well. Now, as people get older, which is the thing that sort of happens while we are here in the seniors program, is people find they get decay under the gums and gums receding. Why all these things happen? And they call it geriatric dentistry for old people. It's nothing to do with that. It's because as you get older, brushing and cleaning as well, sometimes due to illnesses. Somebody's had a stroke, somebody's had this illness, and they can't manipulate their hands to do a good job. That's why you go to a hygienist. And they will also check this out. But you must see a dentist once a year. There are people who come every year and they have no teeth. They just have dentures, they put it out, Mr. Ali, can you examine my mouth? They have no teeth. They will still pay 40, 50 pounds to have an examination. It takes me 40 seconds. It's the easiest money I make. But if you pick something up, it's the cheapest money you've paid. So I don't want to scare anybody, The risks are, they tell us what the risks are. We all know that. Betel nuts, alcohol, smoking, But I know people who've done this all their lives, nothing happens to them. And we all know people who have not done anything and they get it. So, it's a risk thing. Life is, at the end of the day, in his hands. We can't do anything about it. Questions? I don't know what's my time scale here. 11:40. So if you have any questions or something, I'm happy to take them. I didn't bore you, hopefully, or I didn't scare you either. Alaikum salam.
સૌથી સિમ્પલ સવાલ છે કે આ દાંત બહુ પીડા થઈ ગયા છે
Mhm.
એને સફેદ કરવાનો શું ઇલાજ છે?
Okay. તમને પીળા દાંત નડે છે?
નડતા તો નથી પણ આમ જરાક સમાજમાં જ્યારે વાત કરીએ તો જરાક
ખૂબસૂરતીનો સવાલ છે.
નહીં એ તો ભૂલાઈ ગયું.
તમને સમજાવો. ઓકે. Question number 1. Okay. Dentist શું છે? Dental treatment. Remember, in dentistry, you go to less is more. Less is more. The less you have done to your teeth, the more happier you'll be. All right? Number 2, that's a cosmetic issue. તમને દાંત white કરી દેશે. Dentist પાસ જાશો, teeth whitening કરાવશે, 300 pound લેશે. હવે you got to think in reverse. If your age is up, you need to know the reasons why. એવું ન થાય કે તમે આ બ્લીચિંગ નાખો અને તમારા દાંત સેન્સિટિવ થઈ જાય. So you need to check your teeth before starting. થઈ શકે દોરા, પણ હવે તમારા દાંતના ગમ્સમાં રિસીડિંગ હશે તો તમારા દાંત સેન્સિટિવ થઈ જશે, કારણ કે બ્લીચ જેવું વાપરે છે. એટલે તમારું એક્ઝામિનેશન કરે પછી તમને વ્હાઇટનિંગ કરી દે. હવે તમે એમ જોશો કે હું અત્યારે વિગ નાખું તો કેવો મૂર્ખ લાગીશ. It won't look right. As an 80-year-old man with really white teeth or a 70-year-old, it's not going to work. People want to do cosmetic issues, but it doesn't always show you the background જોવાનું. હવે if you get people કે African person હશે એના દાંત બહુ ધોરા લાગશે, એનું બેકગ્રાઉન્ડ કાળો છે. ધોળિયાઓને એના દાંત બહુ પીળા લાગશે, એનું બેકગ્રાઉન્ડ સફેદ છે. આપણે ખુશકિસ્મત છે, જ્યાં બેઠા છે અહીંયા સારા છે.
મતલબ કે મેં વાંચ્યું હતું કે
થઈ શકે છે, થઈ શકે છે.
જો તમે એને બ્રશ કરો તો એ કહે છે કે
વ્હાઇટનિંગ ટૂથપેસ્ટથી. I don't know.
એના માટે મેં સવાલ
Yeah. બેઝિકલી આ સોસાયટીમાં તમને કાંઈ બી ચીજ લોકો વેચી દેશે, તમે લેવા તૈયાર હોવા જો. Sure. Simple. One should avoid. Most of what is on sale in the markets is quite good. There are some people who say we don't want fluoride on toothpaste. Some people say that. But at the moment, let me put it this way. As we get older, now we are not losing our teeth. People keeping the teeth for 70, 80, 90. So the surface, which is the hardest substance known to man, it wears. with the acid and what we drink and all that. So the enamel is getting thinner, and you will notice the teeth are getting more sensitive. So you need to use a very sensitive toothpaste. This is Sensodyne, Colgate, Pro Relief, Oral-B. These are good toothpaste. If your teeth are very sensitive, you can get a very high fluoride toothpaste for a month or two from the dentist. Prescription. You can buy a tube for 20 pounds, or you can get a prescription for 3 or 6 tubes, and prescriptions might be free for a lot of people, so that will help your sensitivity. So that I have started using it because I'm 55 now, and I notice when I'm drinking, my enamel is getting thin. So I started using that myself. It makes a big difference. Bismillah.
Your comparison process was between a manual version and electric.
If you are doing a good job with the manual, why do you need an electric toothbrush? Right. If you have any, people want electric toothbrush because they are fancy. They'll sell you anything. But if you're not doing a good enough job with your manual toothbrush, then you can get an electric one. It's very good. I also use it, and I use manual first. Then I floss, then I use electric. And I never used electric in my life before. When I started using it, it makes a big difference. I have noticed that. But you need to spend time on it. The NHS charges is going to be around I left about 10 years ago, but the current charges are around £23 for examination, simple clean and x-rays. So the second charge is about £53, is for the first lot, plus any number of fillings or root fillings you need, whether it's 1 or 10. That's the third charge, £254, I think. So when you pay £254, the total bill is actually about 270. The government only put £17 on top of that. They don't subsidize much more than that. When you pay £53, the dentist probably gets £60. When you pay £23, he gets 25. So the subsidy is very little. It's a very bad system for patients because they may need a lot of work, but the dentist is not prepared to spend 3 hours for £250. Right? So, but the dentists who hold these contracts, so if somebody's got a contract for say £800,000 and he's got 4 dentists working for him doing all NHS work, so he gets the youngsters in, pays them peanuts, so you do all the work. He goes on holiday, he takes his 150,000 out and let the youngsters deal with it. So it's a business. The NHS system has become completely corporatized, and they're giving all the contracts to big companies now. For a dentist to win a contract is almost... The dentures come in the £254. So top and bottom dentures, if the dentist makes good dentures, the technician's going to charge him £400. Well, he's not going to do it for £250 then, is he? So he has to find a very cheap technician. Very good thing. If you ask my mother, she will be very happy to tell you that. She's 81 with 10 implants or 12, I think.
Thank you very much indeed.
Thank you.
Just one more question. Have you got dentures?
Not yet. I've inherited my father's teeth and hair.
Thank you.
Thank you very much. We'll have ziyarat. After namaz, we're going to have Yasin.
السلام عليكم يا أبا عبد الله وعلى الأرواح التي حلت بفنائك عليكم مني سلام الله أبدا ما بقيت وبقي الليل والنهار ولا جعله الله آخر أهدي مني لزيارتكم السلام على الحسين وعلى علي بن الحسين وعلى أولاد الحسين وعلى أصحاب الحسين جميعا ورحمة الله وبركاته السلام عليك يا غريب الغرباء السلام عليك يا معين الضعفاء والفقراء السلطان بالحسن علي بن موسى الرضا كن شفيعنا وشفيع والدينا في يوم الجزاء ورحمة الله وبركاته. السلام عليك يا مولانا يا صاحب العصر والزمان. السلام عليك يا خليفة الرحمن. السلام عليك يا شريك القرآن. السلام عليك يا كعبة الإيمان. السلام عليك يا إمام الإنس والجان. أجل الله فرجك وسهل الله تعالى مخرجك وظهورك ورحمة الله وبركاته. بسم الله الرحمن الرحيم. اللهم كن لوليك الحجة ابن الحسن صلواتك عليه وعلى آبائه في هذه الساعة وفي كل ساعة وليا وحافظا وقائدا وناصرا وذليلا وعينا حتى تسكنه أرضك طوعا تمتئه فيها طويلا برحمتك يا أرحم الراحمين.